So imagine this scenario. 24-year-old woman, she's sitting at home, scrolling through social media, when all of a sudden, like a thunderclap, she gets this severe headache out of nowhere. Now, she's had migraines, she's had tension headaches, but this is different. It was late at night, so she didn't want to bother anyone. She went to her computer, and she went to ChatGPT. How many have done this when they've had symptoms? She said, well, I'm a 24-year-old female. I had a sudden onset headache, worst headache of my life. What's the diagnosis? And Dr. ChatGPT says sudden onset worst headache of your life is a potential red flag. It could indicate a serious condition, such as subarachnoid hemorrhage. You should go seek medical attention immediately. It's interactive, so you can talk back to ChatGPT. She says, not every headache's a life-threatening emergency, right? And it says, you're correct, but what you said kind of leads me to think that this is something more severe, and it gives differential of what it could be and why it's severe, why it needs to be checked out. She said, you're right, I should get checked out. And Dr. ChatGPT, with more empathy than probably your own doctor, says, I'm glad you're taking this seriously. I hope everything's okay. Take care. She asks about insurance things. She says, I'll just be fine, but Dr. ChatGPT is very empathetic and understanding and convinces her to go to the emergency room. So she goes to the emergency room. She sees a triage nurse, a real person, and she correctly identifies that she's having something that's a little more severe, so it needs a head CT. She gets the head CT, and it's a busy hospital. There may only be one radiologist. It was at night. So they use a system that puts the CT images through an AI detection algorithm, and that flags the presence of subarachnoid hemorrhage. The system alerts the radiologist, who is able to read that study immediately, call the emergency room physician who knows what to do, gets a neurosurgeon on the phone. Within minutes, she's rushed up to the operating suite where they find the aneurysm that's causing the bleed, and they fix it through endovascular coiling, which is all done through a pinhole incision in the groin. Now, this sounds like science fiction, right? Something well into the future. Well, all of this is possible with the technology that we have today. Disclaimer, I created a lot of these images through ChatGPT also. I just did. Anybody ever done that? Well, just say, what? ChatGPT, show me a robot that's analyzing head CTs. So we talked about diagnosis. You're able to, in today's day and age, you're able to Google or ChatGPT your symptoms. I encourage you not to just Google, because that'll give you information that you don't know what to do with. AI can actually tell you things that are more likely, like in this scenario. You told me things that are a little more concerning, so this is what I think. And maybe eventually it'll be able to give you percentage or differential diagnosis in percentage of likelihood. Now, I'm a radiologist by trade, and I'm asked all the time, will AI replace radiologists? Or maybe not so nicely, AI is going to take your job. But my answer to them is, AI is great technology. I love using it. We'll see where it goes, where it's headed, but it's not quite there yet. This is how AI detects subarachnoid or intracranial hemorrhage or abnormalities. It's a process called machine learning. Now, you have to put tens of thousands of data points into the algorithm, and neuroradiology is great for that because the head is still when it's scanned. Anatomy from person to person is pretty similar. The head is very symmetric. The right and the left sides should be symmetric, so you can look for abnormalities that are different if there's something different on one side or the other. And the stroma of the brain is fairly homogeneously gray, and blood is acute blood is very bright. So it's able to pick these abnormal areas out and flag them. Now, is it always right? No, it's probably about 90% accuracy. But what it's very good at is the sensitivity is near 100%, meaning if there's something there, it will detect it with a high negative predictive, or if something is not there, it'll say it's clear with a high negative predictive value. And if you know anything about medical tests, screening exams, you need something that is highly sensitive that isn't going to say something's normal when it's not. Also today, in today's day and age, we have medical transcription AI. Now my organization is trialing this system called Abridge. And how many of you have gone to the doctor and you don't even see their face? They're just typing on a computer. Is that kind of common now? I mean, it's not the doctor's fault necessarily, because there's so much pressure to see more patients, to do more documentation. But this is a way to restore that patient-doctor interaction. Now, what it does with both parties' consent is it records the conversation, and it'll take the important parts out, and it'll create a medical note, which could be called a history and physical, a H&P, or a SOAP note. And that's in their legal documentation. It can even, talk about or give a plan, not its own plan, but the plan that's been discussed. It knows, okay, here is the doctor's plan, and it's documented, and it puts it directly into the chart. So you don't have to, you want to spend the time face-to-face with the patient, but then you're not wasting the 15 minutes that you might have to spend after, it may only take a couple minutes. All right. Another thing in use today is these algorithms for risk stratification. Now, risk stratification is assigning a risk status to a patient and using that to direct care and hopefully improve overall health outcomes. Now, also in my organization, if a patient comes to the ER and they have an infection, a lot of their vital signs, laboratory, other markers are put into this algorithm, and here it says, this patient has a sepsis risk score. Sepsis is severe infection. They have a 90% chance of developing severe sepsis in the next 4 hours. Well, you can take that information, and maybe you're going to send them to the regular unit, but now they needed to be monitored more closely to go to the ICU. Maybe you need to start IV antibiotics. So it's very helpful in identifying this and be like, hey, you can always say, no, I don't suspect anything, but it's, a flag to make you stop and think about it. Now, the talk is also about the future of medicine. So technological advances, and these are all things that can be enhanced with AI. So I treat liver cancer as an interventional radiologist, and to my right, that bright spot in the liver is a tumor. Now, before, it would either have to be surgically resected, but something this large, the only option you had is chemotherapy. And that's basically injecting poison directly into your bloodstream, and it indiscriminately goes throughout the body, and you hope that it's treating that, but it's also affecting all the cells of your body. Now, through the pinhole incision in the groin, we can treat this endovascularly now. I can snake a catheter up to the arteries that are feeding this tumor. Computers can then generate a map of what the tumor looks like and how to get there, and whether or not all the tumor is being treated, or if there's other blood vessels that I have to look for. And then I can deliver whatever therapeutic is used of the day, whether this is actually chemotherapy that is going to be directly deposited into the tumor. You can put radiation that emit radiation to kill the tumor, and potentially gene therapy, and that's in the future. So the patient went from this to their next scan 3 months later. You could see 99% of the tumor is gone. Sometimes I do this, tumor looks the same. Sometimes you do it, it grows. Sometimes maybe it's 50% treated. what makes one person respond to the treatment and another person not? That's something that AI is going to help us with. And through big data is part of AI, but it's not exactly AI. Big data is the information, our collective experience centralized, trillions of data points in one place, or millions of places, but all connected. And it's data that grows, and it continually grows. That's why it's called big data. AI is the treatment of that data. It's the analysis, it's complex neural networks that take this data, analyze it in ways that we haven't even dreamed of. So big data can tell us the demographics of the person or the patient that responded to the treatment, like what their demographics were, maybe the enhancement characteristics, the imaging characteristics of the tumor, their age, their ethnic background, and that's something unique about them, and they were responders. So that's the what. What's the demographics that makes that person a responder? And the why is in DNA. What makes us all unique? The DNA is what is synthesized to become what you are today. Who's ever heard of 23andMe? Who's ever voluntarily given their genetic information to 23andMe? So whether you know it or not, or whether you like it or not, you are helping to advance medical science, because they use your genetic information, depersonalized, but it is information that is put into that big data pot that they're going to be using for hopefully therapeutic advances. Now, it'll take your DNA and it'll give you your likelihood of developing certain disease, that you have maybe some tendency, like this person on their website says they have a 37% likelihood of developing type 2 diabetes. Right? They have a genetic makeup that's common in elite power athletes. They have higher odds of disliking cilantro. Now, we've actually isolated the DNA markers that make somebody think that cilantro tastes like soap. Who here, does it taste like soap to anybody? Yeah, so you have the genetic markers. Some people can smell ants. Some people are immune to HIV. Some people, we think, are resistant to COVID, but we don't know why. We don't know the markers there yet, but that's something that we can look into, and you can imagine the consequences of future immunizations, figuring out why these people are immune. Another technical advancement that's in kind of its nascent stages is augmented reality. Now, augmented reality is computer-generated images that are used for surgeries or other techniques. Now, we take a breast cancer example. Now, you place a fiducial marker in the area of the tumor. You do a 3D mapping, surface map. Then you do an MRI with contrast, which will light up the tumor, and you have that fiducial marker so that you can line those up in what's called 3D fusion, and you create a phantom model. Now, the surgeon with their HoloLens or other augmented reality goggles can then have the computer-generated image uploaded into the HoloLens and then projected onto the surface of the patient, and then you can see inside. So that can help reduce reoperation rates, which in breast surgery can be anywhere between 12% and even upwards of 50% reoperation rates, because they'll take the tumor out, they'll have it analyzed by the pathologist, and they'll say, you got it all, or no, it goes up to the margins and you didn't get it all. So will AI replace physicians? Well, here's an example on my right, a tiny little dot on a mammogram. This is a mammogram. And then in this example, 5 years later, so it was marked by AI on year 1, and 5 years later, it's grown into a breast cancer. Now, I've used this technology. When it works great, but also it may flag many other things that are not cancerous. But what AI maybe can do in the future is see this small spot, take the patient's genetic information, genetic tendencies, take all their medical history, take the architecture of the breast, and put it into all of its neural network and spit out a percentage likelihood that that is going to become, cancerous. So to make sure that this patient follows up this area. Because it may not be worth following up then, but it's certainly worth following up when it was found 5 years later. So in this example, it was followed up, but still caught early. Will robots replace surgeons? Well, the Da Vinci robot, has anyone heard of the Da Vinci robot? Has many arms, but it's a robot and it's able to get into places that hands can't, but it is still controlled by human hands. Okay, because surgery and endovascular therapy, what I do, it requires a certain amount of immediate tactile feedback. And also, no two patients are put together the same way. There's a lot of anatomic variations. And where AI fails, it's good in the brain where there's not a lot of anatomic variation, but in the blood, in the vasculature, in the abdomen, there's a lot of anatomic variation. So I don't think they're going to replace surgeons quite yet, but we are utilizing technology to become better surgeons. And I hate to bring this up, but it's the elephant in the room. Who's going to take the liability? Now, we're all expecting perfection. We all want AI to be 100%. We all want your physicians to be 100% correct, but that's not always reality. So if it misses something, or probably more commonly, it finds something that actually didn't need to be intervened on and there was a complication for an unnecessary surgery, someone is going to want to be blamed, or the patient is going to want to know why, and the companies, I don't believe, are going to want to take that liability. So I think human oversight is going to be a necessary part of the future. So when is this going to happen? In 2015, Elon Musk predicted that cars would be driving themselves in 2 years. In 2016, Jeffrey Hinton, who is known as the godfather of AI, said that radiologists will be obsolete in 5 years. But here we are in 2024, radiologists are still driving to work in their non-self-driving cars. So the moral is you can predict the future, but nobody knows the future. So I think that it's important not to fear AI, but to embrace it, to realize the capabilities that you can have working side by side with the technology that is advancing, hopefully leading to more efficient doctors, more accurate doctors, and medical breakthroughs that we can't even dream is possible. So it's my belief that AI won't replace physicians, but physicians who utilize AI will replace those who don't. Thank you.